Hello. I'm Matea Yoakum with Ignite Insurance Group, and today we're going to talk a little bit about some of the most relevant or most common questions that we get in regard to Medicare or getting into Medicare for the first time. So the first one is, how and when do I enroll into Medicare? So we're eligible for Medicare upon age 65, or if we are on disability for 2 years or 24 months or more. So the most common time that we see is somebody who is turning 65 or their 65th birthday is coming up. So let's say that someone has an April birthday that they're turning 65. So they would have the month of April, they would have the 3 months prior, so January, February, March, as well as the 3 months following April, so May, June, and July. So essentially, we are granted a 7-month window to determine which health plan we want to opt into, as well as make sure that we have both Part A for our hospital benefit and Part B for our medical benefit all in place. So as far as applying, you can actually go online to SSA, Social Security Administration.gov, click on Medicare, and you can actually apply through their link. Typically, they'll have you create an account to make sure that it is your personal private account with your information in it. And then they'll give you, in most cases, a reentry number to just hang on to. So once you've applied that way, usually about a week or two it can take for them to process everything in Medicare system. And then you can always call back and follow up to just make sure that they have your information in the system. And then usually at that point, when they say yes, you'll receive your confirmation letter from Social Security in the mail that'll have your Medicare number and your Part A and Part B effective dates on it. And for sake of this example, those Part A and Part B effective dates would be April 1st of whatever the year is. Keep in mind, Medicare only recognizes the first day of each month. So if your birthday falls anytime during the month, so anytime other than the first day of the month, your Medicare start date or your Medicare effective date would start the first of that month. So in the April example, it would start April 1st. Now, if you happen to have a birthday that falls on the first day of any month, you would actually get an additional month of Medicare, another prior month. So if you're, again, for the sake of the April example, if your birthday is April 1st, your Medicare would actually begin March 1st. Okay, I hope that makes sense. I hope that helps. And the other way that you can apply for Medicare is, other than going to ssa.gov, is to call them. You can see below the number to Medicare, the 800 number. And then you can also, if you have a local branch that's open and you have some time, it's always a good idea, or can be a good idea, to go into your local branch with your paperwork and everything, and that way you know that you're getting it taken care of there in person. So the second question that I often will receive is in regard to the donut hole, which is in regard to Medicare Part D or prescription drug coverage. This is a very important piece of the Medicare puzzle. So no matter how you're getting your Medicare, if you're going with a Medicare supplement or if you have a Medicare Advantage plan, it's very important that you have or pick up a Medicare Part D for prescription drug coverage as well, because that way you avoid penalties and make sure that you have that coverage in place as you need it. So in regard to the donut hole, we get lots of questions about what is the donut hole? How does that work? So Medicare Part D is essentially going to be standardized across the board. So whether you are getting it through an Advantage plan or through a Medicare supplement, the Part D coverage will be very, very similar. It'll be set up and have the same donut hole or coverage gap dollar amounts. Those dollar amounts will be identical. So for the sake of this video here in going into 2021, those numbers that I repeat here in just a minute will be relevant in 2021. So for 2021, Medicare sets aside $4,130 in total drug costs, meaning your copay or your cost plus the insurance company's cost. So for example, let's say that you have a brand name medication. You go into your neighborhood pharmacy to pick up a medication that happens to be a brand name. Let's say that your copay, for sake of this example, is $50. You would pay your $50 to the pharmacy, and then you'd take your medication and go on your way. Well, even though you only paid $50 toward your prescription, your insurance carrier, whichever carrier it happens to be, has assumed the rest of that medication or risk of that drug or cost. So for sake of round numbers, we can call that maybe another $200. So your cost of $50 plus their cost, in this case of $200 combined, is $250. So that $250 would go toward your $4,130 allotted amount that's set aside for you by Medicare. That $4,130 is per person per calendar year. Okay, so what happens if you max out your $4,130 prior to the end of the year? What happens? Well, then you would fall into the donut hole, meaning that you would then be responsible for 25% of brand names or generic medications until you reach $6,550. Okay, so the $6,550 is essentially the ceiling on the coverage gap or the donut hole. So what happens if I max out the $6,550 prior to the end of the year? What happens? Then you make it all the way to the catastrophic coverage, which you would then only pay a few dollars, $3.70 or $9.20 for brand names, or 5%, whichever is greater, through the end of the year. Okay, I know that's a lot of information, so please feel free to reach out to me should you have additional questions in regard to the donut hole. So keep in mind, the donut hole is those dollar amounts are standardized, so it doesn't matter which insurance carrier you take or whether or not you have a supplement or an advantage plan, your prescription plan donut hole dollar amounts are going to remain exactly the same. So the third most relevant or common question that I'm receiving right now is in regard to group coverage. So this would be employer group coverage, meaning that if you are still working and still getting your insurance through your employer, how does that work? So the question that I usually get is, do I need to enroll in Medicare if I'm still working? Well, the answer is no. If you are still working and you're still receiving credible group coverage, you do not have to enroll into Medicare Part B as in boy. If you are 65 and older, your Medicare Part A probably already went effective the first day of your birthday month that you turned 65. So Part A is automatic and to most people has no additional cost, assuming either you or a spouse have worked at least 10 years or 40 quarters. So no need to worry about Part A. It really is usually most relevant to Medicare Part B because Medicare Part B to most people does have a monthly plan premium. If you are drawing on Social Security, that premium would be coming out automatically if you've signed up for it. If you have not signed up for it, or if you are not drawing on Social Security, that would be billed to you quarterly. So you'd get a 3-month bill, or you'd get a bill for 3 months of Medicare Part B premiums. So again, the answer is no. If you are still working and still have credible group coverage, you will receive no penalties should you continue to work and not go on to Medicare Part B. Now, if you retired, the government actually allows you a 63-day window once your coverage ends to apply for Medicare Part B and for it to go effective. Typically, you want it to go effective the first of the following month, just so you have no gaps in coverage. But as long as your group coverage is still in place, you don't have to worry about that. So the fourth question, or most relevant common question that I seem to be getting lately is, what is the bottom line of my health plan? What is my worst case scenario? So in the case of some true catastrophic event happening, it's really important to know and understand how your coverage works and what your worst case scenario or bottom line might be. So really it depends on the type of health plan that you have. So if you were to have a Medicare supplement insurance plan, you would continue to pay your premiums, your monthly plan premiums every single month. And as long as you pay those premiums, you would have very little or nothing out of pocket depending on the supplement plan that you have. For example, if you have a Plan G, the out-of-pocket in addition to the monthly plan premium, would just be the one-time annual Part B deductible. For the year of 2020, that deductible was $198. So for somebody who has a Plan G plan, once they've met that $198 deductible, everything else major medical under their Plan G would be covered at 100%. So as far as the bottom line for that person, they would just keep in mind their premium, so the premium times 12 plus their $198 one-time annual deductible. Now, let's say that somebody has a Medicare Advantage plan and they are wondering how that works. So many Medicare Advantage plans are $0 monthly. So for sake of this example, we'll assume that that's the case. So if somebody has a $0 monthly plan premium, they would have copays based on any medical services that they use. So in this case, and in most Medicare Advantage plans, they have a protective ceiling, or what we call a maximum out-of-pocket. So with a maximum out-of-pocket, it's a set dollar amount or a protective ceiling that would be essentially their stop loss. So if a member of a Medicare Advantage plan had a truly catastrophic year where their copays were really adding up and they reached that maximum out-of-pocket, and those can really vary. Well, in this case, we'll call it $5,000. If it reached that $5,000 for the calendar year, that member would get to stop paying, and their health plan would pay 100% of their major medical costs through the end of the calendar year. And then in most cases, the Medicare or the maximum out of pocket would start over come the beginning of the year, starting January 1st. So as far as the bottom line, the maximum out of pocket is a great determining factor. You also want to take into consideration any deductibles and any premiums that come into play. So the fifth kind of most relevant common question that we have been receiving most often right now has been in regard to Medicare Part B as in boy. So the question is, how do I determine my cost? What will that be? So depends on your tax bracket. It depends on your adjusted gross income. And you can find that information, you can go online and find that information, exactly what that would be. For 2020, the standard general tax bracket was dollar amount for Medicare Part B was $144.60. And it could be higher if you fall into a higher tax bracket. The government does go back 2 years in tax returns, so it would be determined by that. Some people also receive state assistance, state financial assistance through either Extra Help, Medicare savings plans, Health Net through California, or Medicaid, state Medicaid programs. So it just depends on which state that you happen to be in, but it is determined through your income and assets for the Extra Help or the Medicare savings program. So if you're wondering what yours would be, you can, like I said, you can go online and search via your tax bracket and find out exactly what your premium would be that way. Or if you are receiving some of those state or federal program assistance programs, it would either be picked up for you by your state or it would be reduced. And so your state would be able to tell you that as well as Medicare. I hope that helps. I hope this was very beneficial for you. Please drop any questions or comments down below. I'd love to answer them and help make sure that you are in the most appropriate place for you in regard to your Medicare. Thanks so much for watching.